Did you know that subtle changes in your digestive system could be early signs of bowel cancer? Have you ever ignored persistent abdominal pain or changes in your stool? These could be early warnings of a disease that often goes unnoticed until it reaches an advanced stage. Bowel cancer is becoming increasingly common and is already the third most prevalent type of cancer in Brazil, affecting men and women of all ages. But is it possible to detect the signs early and prevent serious complications? Today, you will discover how your body may be warning you about this condition. By the end, you will also learn about the importance of medical screenings and lifestyle changes to protect your health. The human body is an extraordinary system that signals when something is wrong. In the case of bowel cancer, these signals often begin subtly but become more noticeable over time. Unfortunately, many people dismiss them as minor digestive issues. One of the first warning signs is a change in bowel habits. Frequent alternation between constipation and diarrhea could indicate an underlying problem affecting the intestines. Another significant sign is blood in the stool, which many attribute to hemorrhoids. However, it could also suggest internal bleeding caused by tumors. Additionally, excessive fatigue and anemia can be linked to small, unnoticed blood loss. A lack of iron should not be ignored, as it could indicate internal health concerns. Recognizing these early signs and acting promptly can make a significant difference. Paying attention to your body's messages could save your life. There are many misconceptions about bowel cancer that can delay diagnosis and hinder prevention. A common belief is that it is primarily hereditary, but in reality, only about 5% of cases are linked to genetics. The vast majority are associated with lifestyle choices. Research indicates that poor dietary habits significantly contribute to the development of this disease. Diets high in ultra-processed foods and excessive red meat while being low in fiber create conditions that encourage the formation of polyps, which can eventually turn cancerous. Stress and a sedentary lifestyle are also contributing factors. Chronic stress disrupts the gut microbiome and increases inflammation, while physical inactivity slows digestion, compromising intestinal health. Although these factors are well known in medical circles, public awareness remains low. The good news is that simple changes, such as a fiber-rich diet, regular exercise, and stress management, can greatly reduce the risk of bowel cancer. For years, many believed that bowel cancer was largely inherited. This misconception leads some to assume they are safe if their family has no history of the disease. However, studies show that 95% of cases are linked to lifestyle and environmental factors rather than genetics. Diet plays a crucial role in bowel cancer risk. Processed meats and ultra-processed foods increase the likelihood of developing the disease, while a diet rich in fiber, incorporating fruits, vegetables, and whole grains, helps maintain intestinal health. Lack of physical activity is another significant factor. A sedentary lifestyle slows digestion, allowing harmful substances to remain in the intestines longer, creating a favorable environment for polyps to develop. Smoking and excessive alcohol consumption also increase the risk, not only for bowel cancer but for many other serious health conditions. While genetics may play a role, lifestyle choices are the key to prevention. The large intestine, or colon, plays a crucial role in overall health. It performs three primary functions. Excretion converts digested food into waste and removes toxins. Hydration reabsorbs fluids to prevent dehydration and maintain bodily functions. Microbiota regulation houses beneficial bacteria that aid digestion, produce vitamins, and strengthen immunity. When the intestines are unhealthy, these functions can be disrupted, leading to constipation, diarrhea, and inflammation. Understanding and addressing these changes is vital for preventing serious diseases, including bowel cancer. Bowel cancer does not usually develop suddenly, it often presents subtle but persistent warning signs. Here are 9 symptoms to watch for. Changes in bowel habits, unexplained shifts between constipation and diarrhea. Blood in stool, may appear as bright red spots or dark, tarry stools. Anemia, low iron levels, which could indicate hidden internal bleeding. Chronic abdominal pain, persistent cramps or discomfort. Unexplained weight loss, losing more than 10% of body weight without lifestyle changes. Frequent nausea or vomiting, especially without any clear stomach-related cause. Constant fatigue, could be linked to anemia or chronic inflammation. Persistent bloating, a feeling of fullness even without consuming large meals. Lumps or sensitivity in the abdomen, advanced sign requiring immediate medical evaluation. If you experience any of these symptoms, seek medical attention as soon as possible. Early diagnosis can significantly increase the chances of successful treatment. Early detection is crucial for effectively treating bowel cancer. When diagnosed in its initial stages, the chances of recovery are significantly higher. The primary diagnostic test is a colonoscopy, which allows doctors to examine the colon and remove any suspicious polyps. Additionally, a fecal occult blood test can detect hidden blood in the stool, signaling potential issues. Imaging tests such as CT scans or MRI can assess cancer progression. Individuals with a family history of bowel cancer or risk factors should undergo screenings more frequently and begin them earlier, often before the age of 50. The good news is that many cases of bowel cancer can be prevented through simple lifestyle changes. Adopt a fiber-rich diet, increase intake of fruits, vegetables, whole grains, and legumes. Reduce processed and red meat, minimize consumption of processed foods and meats like sausages. Stay hydrated. Drinking sufficient water helps maintain healthy digestion. Exercise regularly. Activities like walking, running, or cycling improve gut function. Manage stress. Chronic stress affects gut health. Practices like yoga or meditation can help. Avoid smoking and excess alcohol. Both habits increase cancer risk. Your health is in your hands. While genetics and external factors play a role, the daily choices you make have a powerful impact. By recognizing the early signs of bowel cancer, adopting a healthier lifestyle, and undergoing regular screenings, you can protect yourself and inspire others to do the same. Every step, choosing nutritious foods, staying active, managing stress, brings you closer to a healthier future. If you notice any warning signs or have risk factors, consult a doctor and undergo the necessary tests. Prevention and early action can save lives. Now is the time to take control, make changes, and prioritize your well-being.